I'm Moriah, please call me Moriah, and I've been teaching human sexuality off and on at Temple since 2006, and it's always really exciting for me to come and talk to a class about these topics because I now work in the world of nutrition most of the time, so not really the same. But just to give you a little background, I got my master's in public health here at Temple University, and while I was getting my degree, I was teaching classes. And once I graduated in 2008, I started working at a nonprofit organization in the city called the Food Trust, and we do nutrition education, food access, farmers markets, you name it. So that's a little bit about me. Getting married in September. I don't know if that's important information. I'm just really excited. And I want to kind of keep this casual. I have a lot of information to give you today, but it's really important to me that you stop me at any time that you have a question, anything's unclear. Just please interrupt me at any time because basically, yes, this is a class, you're getting 3 credits, but this is pretty important life information. So it's important that you know this in and outside of class. So please, just anytime you need to interrupt me, feel free. So I like to just warm things up a little bit, throw things in your face. I have a few words to live by for you. First, ladies, if you're experiencing abnormal discharge, itching, stinging, burning, lumps, bumps, sores, or any general discomfort in the genitalia, I told you, we're jumping right in. That's for the ladies. For the gentlemen, if you're experiencing discomfort, urinating, or ejaculating, lumps, bumps, sores, or any general discomfort internally, externally, guess what? Get checked immediately, okay? And a lot of us take this very obvious information for granted. You are the #1 expert on your body, okay? So anytime something feels off, anytime something has come that wasn't there before, definitely get checked out. And I like to start out there because before I start telling you about all these things that can go wrong, I just want to remind you that you should feel empowered to get yourself checked anytime something's going wrong. And as you'll see as we move through some of these things, not all of them have symptoms. So even if you don't have a symptom, it's good to get checked. Okay? So, first I'm going to talk about some of these sexually related diseases. And they're sexually related diseases because they affect the reproductive organs, but they're not always sexually transmitted. So, I'm just going to start there. First, we have bacterial vaginosis. In case the vaginosis didn't give you a clue, this is a ladies' disease only. And this is basically when the normal balance of bacteria in the vagina is disrupted, and that allows overgrowth of bacteria. And there's always bacteria present in the vagina, there's always yeast present in the vagina, but other bacteria is there to kind of keep that in check, to keep it from overgrowing. And when it overgrows or it's disrupted, that's when you can have some of these sexually related diseases. So, the symptoms for BV are abnormal discharge, odor, pain, itching, or burning in or outside of the vagina. And the discharge piece, I just want to take a moment to mention. For ladies, there's a normal discharge. Every single day, the vagina has a discharge. However, we're talking about abnormal. Any change in discharge is considered abnormal most of the time. So you just have to think about what's normal for you. The most common age group affected by this is women of childbearing age, so usually that 15 to 30 range, and it can clear on its own, or it can be treated with antibiotics. And the tricky thing about BV is a lot of people think it's a yeast infection, and don't worry, that's coming up next, just in case you're worried. But it's not the same, so you do have to treat it differently, and you have to get checked out. Okay? So any questions on BV? Did you think that this morning you just walk into a class and you'd be talking about vaginas straight off the bat? Here we are, we're here. Okay. All right. The next one is candidiasis. And candidiasis is a yeast infection. And this is again caused by an imbalance of bacteria in the vagina, but the difference here is the imbalance of this bacteria is what causes yeast to overgrow versus other bacteria. So the yeast multiplies beyond what the vagina can handle. And some of the ways that candidiasis can occur in women, I have a couple up here. Antibiotics is probably the biggest one. So if you have strep throat or any kind of, not disease, any kind of bacterial infection that requires antibiotics in your body, when you take antibiotics, they can kill bacteria all over your body, including the bacteria that your body needs. So that's one way that you can experience that imbalance. Tight clothing with synthetic fabric, staying in a wet bathing suit, you name it, they can all lead to yeast infections. I have a great story that my friend wishes I never told people, but I don't know if you guys are ready for it. You're awful quiet. What do you think? Sure. Okay. Anyway, she was at a Phillies game. This is just an example of how commonly this can happen. And maybe loosen you guys up a little bit. What do you think? Okay. So I had a friend, she was at a Phillies game. That's probably relevant to everybody in the room. I see a few other types of cats out there. But it was middle of July. It was really, really hot out. They were in the high seats directly in the sun. She sat there for 3.5 hours during the game, really sweaty. She sat in a car with no air conditioning the whole way home. Guess what? Surprise! And she got home. She had a yeast infection. So I just want to mention this because any kind of moisture that doesn't get air into the vagina can also cause that imbalance of bacteria. Okay? So some of the signs or symptoms would be burning, redness, or swelling of the vagina and vulva, pain when passing urine, pain during sex, specifically intercourse, soreness, a thick white vaginal discharge, or a rash on the vagina. Pretty obvious when you have one of these. And there are over-the-counter medications, however, they don't always work. So if you use one and you notice that you're still experiencing symptoms, definitely get checked out, or you may have BV, and those over-the-counter remedies are not going to cut it. All right. Any questions here? Yes?
You said staying in a wet bathing suit?
Yes.
So, like, do you have to stay in a wet bathing suit for a while? Like, if you go to the beach and you're...
Well, I mean, usually it's for a really prolonged amount of time. I would say hours and hours. If you're at the beach and you lay on the towel, you dry off, that's a different story. But if you're, let's say, sitting somewhere, it's a wet bathing suit, it basically, the yeast in the vagina loves a moist environment like that, and that's why that happens. But yeah, it's usually like a longer period of time, 2 or 3 hours or more. Good question. Any other questions? All right, we're just getting started. Okay. Pelvic inflammatory disease, or PID. So this is really serious, and young women, and this only affects women as well, young women experience this pretty frequently, and we get about 1 million acute PID cases. Acute meaning that it was so serious they had to get medical attention right away. So the reason why I make that distinction is because usually PID is caused by untreated chlamydia or gonorrhea. And we'll talk about those hello, what did I just do? Or maybe it was this. I don't know what I did. How did I manage this? That's the push button. Okay, we're back. Okay. So it's usually from untreated chlamydia or gonorrhea. And when we talk about chlamydia and gonorrhea, you'll see that they rarely have any symptoms. And if you're not getting checked or tested, then basically chlamydia and gonorrhea, the bacterial infection can grow up into the reproductive organs, through the uterus and into the fallopian tubes, and cause further infection of those organs that can be really serious and damaging, and eventually can become pelvic inflammatory disease. That's when the fallopian tubes are inflamed and they are, it's extremely painful. And usually you don't know that you have it to that extent until it's extremely painful to the point where you have to go to the emergency room. And that's usually when damage has already been done. And what I mean by damage is 100,000 women become infertile in a year because of PID. So worst case scenario, you may lose a fallopian tube, you may lose both fallopian tubes, because they become so inflamed that it can't be treated, and that can be really serious. The other thing is that even if it's treated, which it can be treated, it may have caused permanent scarring in the fallopian tube, so that an egg wouldn't be able to pass through the fallopian tubes, or sperm wouldn't be able to connect with the egg in the fallopian tubes, because that's where fertilization occurs. So that's why it's really serious, and also ectopic pregnancies can occur. So if you have permanent scarring and you're not aware of that, you may become pregnant. You would have all the same signs as any other pregnant woman would have. However, your pregnancy will be growing in the fallopian tubes because from that scarring, maybe the sperm was small enough to pass through, but the egg and sperm together were not able to get further down to the uterus to implant. So you would be stuck, the pregnancy would be stuck in the fallopian tubes. It would attach to the fallopian tubes and begin to grow there. And sometimes you don't know you have an ectopic pregnancy until, again, it's too late or very serious. So, you know, this is beyond the pain and discomfort it causes. It also can cause permanent damage, bless you. So, there are usually no symptoms, like I said, until damage is pretty severe. But if there are symptoms, it's lower abdominal pain, fever, unusual vaginal discharge with odor, painful intercourse and urination, and irregular bleeding. And some people experience lower back pain as well. So, you know, it's good to look out for these things, but if you're getting checked regularly for other STDs, this can be pretty easily avoided as long as you get tested and treated subsequently. So, any questions on PID? And just to give you an idea of what this would look like, a fallopian tube is usually the width of a sewing needle, so it's very, very thin. And an egg is about the size, if you took a pen or pencil and just make a quick dot on your paper, that's about the size of an egg. So the fallopian tube is literally only wide enough for that egg to pass through. When somebody has PID, their fallopian tube could be as thick as a finger. So think about a sewing needle next to a finger and how much of a difference that makes. So it's a very serious inflammation. Okay. So now we're going to move on to STDs. We're going to start with the parasites, which is the first category of STDs. This first one is trichomoniasis, and it's more intimately known as trich sometimes. People like to shorten it. This does affect both men and women, but symptoms are much more common in women. So a male may have trichomoniasis, but have absolutely no symptom or no idea that they have it. It is a single-celled protozoan parasite, and men may have symptoms. If they do have a symptom, it's irritation inside the penis, mild discharge, or slight burning after urination or ejaculation, because it does affect the urethra. For women, also affects the urethra, but women may have an abnormal discharge, frothy yellow-green with strong odor, can't miss that, discomfort during urination or intercourse, and itching. And like I said, most women will have some sort of a symptom, and it will be pretty obvious. It's treated with metronidazole, which is an oral single dose. Just have to get a prescription for that. And if you have it, you can continue to ping-pong it back and forth with your partner if you don't both get treated, and both wait till you're both fully treated before you have sex again. Because if one person gets treated and the other person doesn't, you're just going to keep giving it back and forth. All right? Any questions here? Yes?
Question. Can you pass yeast infection to your male partner?
That's a great question. You can pass a yeast infection to a male partner, but it often doesn't have the same effect. If the yeast gets into the urethra on the male, it causes irritation, but usually it doesn't stick around. But I don't know if they have to seek treatment per se.
So if I get it, then I can pass it like her?
Yeah, I mean, that's the whole point. I mean, if your partner or you have any kind of problem going on, you both should get treated fully before you have sex again. Because, yeah, you could just keep ping-ponging it back and forth. Any other questions?
Does this trichomoniasis ping-pong disorder, does this have any relationship to increasing susceptibility to, let's say, ovarian cancer or anything like that?
I haven't seen anything linked to it per se, but I feel like nowadays everything's linked to everything. I don't know. But there's nothing linking this, because it's just a parasite, to cancer that I know of. But I never say never. So. Any other questions? So, pubic lice. Now I have a quick little anecdote here because we're in a public health class. When I was in public health getting my degree, I was terrified that I would accidentally write pubic health. It was like this irrational fear that I had. It's just one letter different. So I just noticed when I redid these slides that it said public lice because I like eliminated pubic from my vocabulary, I guess. But anyway, I just thought maybe you'd find that amusing because you are also in public health. Pubic lice, also known as crabs, also a parasite. They're transmitted from pubic hair to pubic hair contact. How are they not transmitted? Because I know somebody out there wants to know. So just ask now. What's the question everyone wants to know about crabs and transmission? Well, they certainly do bite. Yes, they do.
It's the toilet seat.
Thank you. The toilet seat. All right. Couple things I want to address with the toilet seat. One, you should be much more concerned about who you're naked with. Okay? You're going to be much more likely to get pubic lice that way than to sit on a toilet seat and get it. Okay? Two, if you're a parasite, what do you need to survive? A host, right? You need a host to survive. That's their whole reason to be, right? What is that toilet seat? Why would it jump off your warm host body onto that toilet seat when that toilet seat has nothing to offer them, right? Really unlikely for that to happen. Again, I never say never, but it's really, really unlikely. And like I said, be worried about who your pubic hair is touching, not what toilet seat you're sitting on. Also, a good tip, don't sit on public restroom toilet seats. Not a bad idea. Okay. So, pubic hair to pubic hair contact is how they will be transmitted. It's treatable over the counter. It's the same exact shampoo that's used for head lice, even though it's a different louse. But you can use the same thing. You go to the drugstore, you can get it, and they give you instructions. You shampoo, you comb, you wash, everything. But how do you know you have it? Well, guess what? Even if you shave all of your pubic hair off, that little crab pubic lice, it's not going to care, okay? It lives in the hair follicle, so it can burrow under the skin. That's where they're going to be. They feed off of the hair follicle, not on top of the pubic hair. They may come up and lay their eggs in your pubic hair, and you can't miss those. They're bright white. But shaving pubic hair, not going to keep you from getting pubic lice. It's extremely uncomfortable. It's itchy. You may see red bumps because, again, they're under the skin in the follicle, which may present as a bump. It's pretty uncomfortable and pretty obvious pretty quickly. So that's what you do. If you have it, you would just want to make sure you get treated and you want to wash everything, sheets, etc. It's not terribly likely that they will be in your sheets, for example, because, again, they want to stay on your host body. But it's always good to wash everything just in case. And once you do all that, you should be in good shape. Any questions about pubic lice? Okay. Scabies is one other parasite infection, and this is not always sexually transmitted, but it certainly can be. So this is another parasite. It is prolonged skin-to-skin contact that will transmit this. It results in intense itching and pus at the site of where the parasite is. And it's seen mostly, you'll see like a little bit of a red rash on the wrists, between your fingers, under the breasts, and on the buttocks. They like kind of to be in like a crease type of area. But here's the tricky thing with scabies. They incubate for 4 to 8 weeks. What does that mean to you? It means that you could be exposed and have them, and they incubate for 4 to 8 weeks with no symptoms. You have no idea, but you are contagious. But once you know you have it, it's treatable with a prescription. You just have to go see a medical professional and get the prescription. But it's not as common as pubic lice, but it's definitely out there. Any questions? All right, we're moving on to the bacterial infections. And the bacterial infection, STDs, chlamydia by far the most well known, also the most common. And the incidence in the U.S. is approximately 1.2 million people. And that was in 2008, which is the most recent statistic we have. Really quickly, what's the difference between incidence and prevalence? Anybody want to take a guess? When I'm saying incidence, what am I talking about here? New cases. Great job. All right. New cases, prevalence meaning at any given time, how many cases are there out there. So this is just new cases, incidents. So that's a lot of people. That's a lot. And, you know, the nice thing about chlamydia, you can have it once, you can get it as many times as you want. So it doesn't stay away forever, it can come back. Just to break it down a little bit, and I wanted to discuss this, female cases, 893,000. Male cases, 313,779. What's going on? I mean, that's a big difference there. Any guesses why we have this huge discrepancy between female and male chlamydia transmission? What did you say? say?
Lesbian?
Lesbians? I don't know. Maybe that has something to do with it. It's not as easy to transmit chlamydia female to female as it is male to male or male to female, but that could be part of it. Why else? What's going on here? Right, so a big part of it is screening and testing. So most women who are sexually active or over the age of 18 or 21, depending on who you are working with for your pelvic exam, are getting annual pelvic exams, or should be getting annual pelvic exams, okay? And during an annual pelvic exam, if you're between the ages of 15 and 25, they will automatically test you for chlamydia and gonorrhea. They may not always tell you, so you may want to say, are you testing me for anything today? But they most likely will be testing you automatically, whether you ask for it or not, because that is the most common age range for chlamydia. So yeah, I mean, just sheer testing and screening purposes, you know, we see more cases that are treated and more cases that are reported for chlamydia. Anything else you can think of? Let's think about anatomy. Let me give you a hint. This is transmitted by infected vaginal fluid or semen. All right, so if you're a female and you're having sexual intercourse with a male and you're not using a condom and his semen is infected, guess what? The vagina is a giant mucous membrane, right? So a female can be infected throughout the entire vagina, while with the male, it's through the urethra, which is a much smaller opening to the body. So just sheer biology tends to make females more susceptible to chlamydia and gonorrhea infection, just because the vagina is a large receptor to these kinds of bacterial infections. Yeah?
So how does the male get infected?
So if a female had, let's say he's with a female and she has infected vaginal fluid, that vaginal fluid would have to enter through the urethra.
So my question is, like, where does it start? Because you just said that the hole is too small for the male to get it, but if his semen is infected, he gives it to the female. How does this semen get infected?
From an infected female. It's harder for the urethra to get a disease, right? The urethra is a smaller opening, but it still can. A male can still be infected by their partner. So at some point, he was infected by somebody else, right? Does that answer your question?
Yeah, but I'm still confused.
Well, let's talk about it. Yeah, what's confusing?
The penis has an opening.
Yeah, no, I know, I get that.
No, I know you do, but if you don't use a condom, that opening is exposed, and the vaginal barrel is rich in capability of passing something to the man. It's
Right.
not, you know, as common, but it's about condom use, really.
Really? I mean, condom use is the easiest way to, well, abstinence is, I don't know, some people may disagree that abstinence is easy, but anyway, it's the best way to prevent yourself from any of these diseases. But using a condom would protect both partners, because if the male had infected semen, it would be caught in the condom and would not go into the vagina. And if the female were infected, then her vaginal fluid would not get through the condom to the urethra, to the male. So, but that's another main reason why we have so many more female cases than male. And just in PA combined, we have 42,233 cases annually, just to give you a local statistic. So, chlamydia, also known as the silent STD, because it very rarely gives you any symptom whatsoever. All right? Silent STD. For women, 90% of the time you get nothing. No symptom. Okay? For males, they say about 70% of the time you get nothing. But men will get a symptom more often than females. Okay? So what are the symptoms if you do get a symptom? One, for females, you'd have an abnormal discharge. So again, color, consistency, odor, any change in discharge. You may have irritation internally or externally in the vagina. You may have itching internally or externally. But those are the main things that you would see. There are no bumps per se that are associated. It's usually discomfort, itching, or discharge. For males, you will usually have an abnormal discharge, which means, guess what? If you're a man, and it's not urine, and it's not semen, you're out of luck, okay? Nothing else should be coming out of there, all right? So if anything else is coming out of there, it doesn't matter what color consistency it is, you should be alarmed, okay? You should get checked out immediately. So any kind of discharge from the penis would be grounds to get tested. But you may also experience discomfort while urinating or ejaculating because it does affect the urethra. All right. So lymphogranuloma venereum, or LGV, is from the same bacteria as chlamydia. We don't see as many cases of this here in the United States, but the symptoms are pretty similar but have a few distinctive characteristics. So the symptoms may include genital papules and or ulcers, so this one is associated with bumps or ulcers. Swelling of the lymph glands in the genital area, which can cause discomfort, or you can actually feel or see them. And it can also include rectal ulcers, bleeding, pain, and discharge of the genitals. Okay? So we don't see as many cases of this, same bacteria. All of these bacterial infections are treatable by antibiotics as long as you get tested and know you have them. And then lastly, we have non-gonococcal urethritis or non-gonococcal cervicitis. Non-gonococcal urethritis can occur in females or males, same bacteria as chlamydia. Non-gonococcal cervicitis, only in females. It's an infection of the cervix internally. Okay? So similar symptoms, if you have a symptom, it would be discomfort, abnormal discharge, etc. Not as common as chlamydia itself is. So we see way more cases of chlamydia in its normal strain than we see of these two other strains. Any questions here? Alrighty. Gonorrhea. So gonorrhea and chlamydia sometimes like to come to the party together. They can infect you at the same time. You could have both, okay? Just like chlamydia, you can get gonorrhea as many times as you want. Once you have it treated, you could get it again and again and again if you have sexual contact with an infected person. So gonorrhea is basically, again, obviously a bacterial infection, but it is transmitted through infected semen or vaginal fluid again. And the bacteria can grow in the cervix, the uterus, and the fallopian tubes, or the urethra for females. It can also grow in the mouth, throat, eyes, and anus, any mucous membrane. It's also passed through contact with the penis, vagina, mouth, or anus, again, with that infected fluid. So even if you had it pass through vaginal intercourse or anal intercourse, for example, the bacterial may manifest in one of these other locations. So it just depends. I've also had some people say, well, how do you get gonorrhea in your eye? I'll let you use your imagination, but it can happen, okay? Basically, gonorrhea is very similar to chlamydia when it comes to symptoms. You may or may not get a symptom. If you do get a symptom, then it's always going to be those classic symptoms for females where it's abnormal vaginal discharge, itching, stinging, burning, or discomfort of the vagina. Or you may have discomfort during intercourse. Anything related to discomfort or abnormal discharge would be relevant here. For the males, again, any abnormal discharge. If it's not urine, it's not semen, you should be concerned. All right, lastly. In the United States, we have a much lower incidence for gonorrhea. We have 336,742 cases. So as you can see, chlamydia definitely is much more common. And it is treated by antibiotics, but there are drug-resistant strains of gonorrhea out there. What does that mean if something's a drug-resistant strain? For anything, yeah. They don't work, right? So what happens is, and this is a good time to have this conversation, let's say you have strep throat, and you were given an antibiotic, and it says, take this prescription until it's done, right, till all the pills are gone. You take it for a couple days, on day 3, you feel great. What do? Usually we stop taking them, right? Guess what? Not going to work here, okay? For chlamydia and gonorrhea, you have to take the entire prescription until it's gone, because that prescription is made to kill all of the bacteria associated with that disease. So, if you, for gonorrhea, the way that we kind of came to be in this drug-resistant strain place, if you do that, where you have the antibiotics, you take them for a couple days, then you stop, sometimes that gonorrhea strain can basically adapt itself around that antibiotic. So now you still have gonorrhea, and you have a strain of gonorrhea that won't work with the antibiotic that you took before. Then you can infect people with that strain, right? So right off the bat, they can't take that antibiotic. Traditionally, we've always used penicillin to treat gonorrhea, but we really can't always count on penicillin because there are these drug-resistant strains and they're increasing. So that's pretty scary if you have gonorrhea and you have a drug-resistant strain. They're trying to develop different types of antibiotics to address this, but there's not, they can't always keep up with the changing strains. So this is definitely a pretty serious thing to keep an eye on. Sometimes we just can't treat it. So, and then going back to PID, you can see the implications here. If you have it and you're not able to treat it, not only are you able to pass it to people, but you're also running the risk of becoming infertile or causing permanent damage to the reproductive organs, getting PID, all of the above. Okay. Any questions about gonorrhea?
In general, can you give them an idea about, do any of these STDs stay dormant for a while? Or, what's the time frame for these things to be
So usually, from a testing perspective, if you think you may have been infected, they usually say give it about 2 weeks before you get your test, because it's possible that you could be infected and it wouldn't show up on a test. But for the most part, we're just usually happy if you're getting tested. Don't let that be a deterrent, but it's good. They say to get tested every 6 months usually. That way you'll catch something along the way. But also that gives you a chance to, if you have multiple partners through different periods of time, you may have gotten tested a year ago, but you may have had different partners since then. So it's important to get tested. Usually the rule of thumb is every 6 months if you're sexually active. Usually women get tested once a year when they go in for their annual pelvic exam, but that's just my recommendation. But yeah, usually it's about a 2-week span where you want to give yourself time before you get tested just to make sure that anything that may come up will come up.
So if you're asymptomatic, some of the things you're not recognizing, it is possible that you have had a number of partners that you might have infected.
Right.
This is one of the ways that couples find out about partners not being faithful. And you have to be prepared for that. Just because you think that your partner is loyal, there's other factors involved now.
Yes, actually, I will give credit where credit is due. There's a person named Patrick McGee who talks to classes about HIV. He has AIDS. He's hilarious and amazing. If you ever see him speaking on campus, try to make it and see him. But he has a great saying about this. All right, can somebody volunteer? I'm not going to pick on you, but just anybody who's in a relationship, would you mind being my assistant for a second? Okay. So if you don't mind me asking, are you in a relationship with a male or a female?
Yeah.
Okay. So you're in class right now. Can you look in your bag for a second? Go ahead, look in there. Is his penis in there?
No, it's
No. Okay. You're here. Where's his penis? I don't know. All right. The point is that, ha ha ha. It's a good one. Okay. The point is that we want to trust our partners, and I'm not trying to be negative in any way about monogamy. We want to trust our partners. We want to know that they are faithful to us, and they want to know that we're faithful to them, right? However, when we're not with them, we don't always know where they are, okay? And yes, trust is a big piece of this, but the harsh reality is sometimes their penis is somewhere else, and their penis is getting infected somewhere else sometimes, or the vagina is getting infected somewhere sometimes. So, it's important to protect yourself on many levels. One thing I forgot to mention in my very brief introduction is for about 4 years I worked in a reproductive health clinic where we did counseling for young people 12 to 20 years old. That was our funding bracket. And we gave free medical services, free birth control, free pelvic exams, everything, STD testing. And basically I was a counselor there, and I can't tell you how many times I would have couples that would come to the clinic together. We would always insist on counseling them separately, and sometimes I would counsel both of them separately, and they had totally different reports of number of partners, how many times they'd had sex in the last 6 months. One might be like, oh, I'm in a relationship, I've only been with one person in the last 6 months. And then their partner comes in and says, oh, 3. But I only have sex without a condom with my actual partner, not with the people outside of the relationship. Oh, thank goodness. But But as a counselor, my hands are tied because I have to keep that confidential, even between them. So it would be frustrating because as a human being, I would say, geez, you know, this relationship, obviously there's a serious communication breakdown. They're not being honest with each other. But, you know, I can't say a word. So that's the truth of the situation. And like I said, I don't want to be negative about relationships because they're great and they're wonderful and we want to trust people, but you have to protect yourself, get tested. You can ask your partner to get tested, but there's no way for you to confirm that they were. So it is all confidential. So it's important that you at least do what you can control, which is testing yourself. So we have touched on a couple of things here. One, if you have chlamydia or gonorrhea and you're informed that you have it, you want to take your medication. You want to get your medication first. You know, sounds logical. Again, the days of working at my clinic, I can't tell you how many people we would call and notify them that they have chlamydia or gonorrhea, and they would not come in for treatment. And I kept thinking to myself, why would you want to keep it? You know, like, there's really no benefit to keeping chlamydia. But some people will not come in for treatment. Don't worry, we have to turn them over to the state, and the state will hunt them down. But if they don't come in, we can't, you know, we can keep calling, but eventually we have to turn them over. But let's say you go in, you get your treatment. You have to take it exactly as it's directed. We also know that we should notify our partners or partner, right, that they may or may not be infected. You may have gotten it from them, they may have gotten it from you. It's not always clear, and that they should get tested and treated. And then there's one more important thing to do here. What do you think it is? Bless you. And by the way, I don't want to downplay notifying your partners because some people really don't want to do that. It may be somebody that you don't know that well. You may, you know, have only been with them one time. But it's important to make that phone call. But what else do we need to do?
Take a guess.
You guys are quiet. I'm not used to such a quiet class. Come on. Nope. You probably don't want to do that. You could if you want. I mean, you're welcome to. Do you think you may want to abstain from sexual contact?
Oh, we're on.
No. Abstain, okay? If you have chlamydia or gonorrhea and you are currently treating yourself for that, do not have any sexual contact of any kind. The full Bill Clinton sexual relation, whatever, none of it, okay? No sexual contact. Condom, no, none, okay? Because guess what? Like I just told you with gonorrhea, let's say you're taking your medication for a few days and you're going to continue taking it, but you decide to have sex anyway during your medication. Again, you may pass a resistant strain. So it's really, really important that you both get treated and tested, you both abstain if you're in a relationship. Otherwise, like I said, keep going back and forth. Yes, ma'am?
Shouldn't that person be tested for HIV? Because I've read that you're more susceptible to other STDs if you currently have them.
I mean, that's absolutely a great idea. I think if you're getting tested for other STDs, at least once a year to get tested for HIV, or maybe even every 6 months as well. It is a blood test versus these are either a urethral culture from inside the urethra or the cervix, or sometimes they do a urine test. The only thing is that you do have to usually request that, so you have to make sure you request it. But absolutely, a lot of STDs are comorbid. They come together. Some of them put you at higher risk for HIV. We're going to talk about syphilis in a second. That has a very high comorbidity with HIV. It's never a bad idea to get tested frequently. And with HIV, and I know you're going to have a person come in and talk about HIV in particular, but there's a whole other window period there where you may have been exposed. It may not show up on a test for a certain amount of time, 3 to 6 months. So that's why, again, it's good to get tested every 6 months regardless. So yeah, that's a great point. Absolutely. Anything else? Yes?
Yeah, you mentioned it briefly, urethral testing. Which diseases do you have to get that from?
Chlamydia and gonorrhea it depends on the lab. So I can speak to the lab that I worked with. This was in northern Delaware. Our lab would only do the urethral test. They wouldn't do the urine test. So for males, that means that there had to be a swab inserted into the urethra. I know, see, and then that was a deterrent for testing, which drove us all crazy because Having an STD is way more uncomfortable than getting a swab in your urethra for a second. But anyway, it's a little bit more uncomfortable, but it's pretty quick. It's over, and then you get your results. But sometimes they can do chlamydia and gonorrhea testing through the urine. And then for females, they can also do a swab from the cervix while they do a pelvic exam. They can just do an extra swab of the cervical mucus and have that tested. So it just depends on where you go. A lot of places do the urine test now, though. Any other questions about chlamydia or gonorrhea?
Why do you turn the information over to the state if a person doesn't want to get tested?
Okay, great question. So, not tested is treated.
Treated.
Right. So, chlamydia and gonorrhea and syphilis and HIV are all reportable diseases, which means that any site that tests for these diseases has to call into the Department of Public Health and report those diseases. Not the people, just the counts of how many people they've seen that tested positive. But if they tested positive and they did not receive treatment, and we would give them a month, and if they still have constant calling and if they didn't come in, we were legally required to turn their contact information over to the state because they're spreading a disease potentially. So from a public health standpoint, it's for disease prevention. So to the Department of Public Health, it's important that that person is treated because otherwise they're potentially spreading it to X number of other people. So that's why we have to turn them over, and that's why they have to be tracked down. And I would never want that job with the Department of Public Health to track people down. If you're in school, they would come to school. They'll find you. They will find you whether you're hiding or not. I mean, they'll find you. So, and there are people who do that for HIV as well. So it's, like I said, I wouldn't want that job, but it is a job. So. Any other questions? Great questions. So I just wanted to show you a couple graphs here. This is, down here is gonorrhea. This is reported cases in females by age. So along the bottom on the x-axis, we have all the different age groups. And then this is chlamydia by age. What jumps out to you about these two graphs? They're all female. What jumps out? Which ages? Yeah, right here. I mean, hello. Look at that. And look, these are two different diseases, and the shape of this graph is exactly the same. Basically, 15 to 25, I'm not kidding you. We see more cases of STDs in that age range for males and females, but especially females, than any other age range, as you can see. So it's a pretty serious situation that we're dealing with in public health because we have limited funding for prevention, but even with prevention, it doesn't always really prevent. And here we are. And it's kind of embarrassing. I mean, we're one of the only countries that looks this bad with STDs, chlamydia and gonorrhea. They're completely preventable. Again, so that's frustrating for public health people. So I just wanted to show you, I mean, when I say 15 to 25, I'm not kidding. Yeah.
Why do you think this is so high versus in every other country?
That's a great question. I think it comes down to age of sex, age of first time having sex, or how old you are as you're being sexually active, and the social perception of contraception and sex education. I mean, all of that. Now, that's not to say there are many other countries that are much more rigid about sex education, or just talking about sex in general, and they may have lower numbers because of that kind of like a shame factor. However, what I do want to mention is that we have a weird situation going on in this country. We inundate ourselves with sex and advertising and TV, and it's everywhere we go, but can't talk about it, right? And it's bizarre. So we see it all the time, we know about it all the time, but we can't talk about it. It's a weird environment to be in. So I think that, especially for young people, it's confusing. They know something about it, but they may not know everything about it. One thing they usually know is it feels good. There you go, okay? So that young group, we're seeing not a lot of contraception, not a lot of STD prevention through condom use, and we're seeing a lot of sex. And there you go. And that's when we see these high rates. So it is frustrating from a public health perspective, but this is where we are. And I think the numbers are speaking pretty loud and clear for us. but there's a lot of political tie-up with funding for prevention, or even just something like passing out condoms in schools. I mean, you name it, there are policies for and against them all over the country, and they vary depending on where you are. So there's just a lot of inconsistency too. Any other comments about this? Okay, so our last bacterial STD is syphilis. And syphilis, we don't see as many cases even as gonorrhea, but it's definitely out there. We have 46,277 reported cases in this country in 2008. And that's the highest number of cases since 1995, which means we're not going in the right direction, right? For a long time, syphilis was not as much of a concern. We had really lowered the rate significantly, and now we're seeing them increase again. So that's something to be concerned about. So, with syphilis, there are 3 stages of syphilis. First, we have the primary syphilis stage, and that's when a painless lesion called a chancre will appear. It usually appears internally or externally on the genitalia, or it can also internally or externally on the anus. But it's painless, okay? So if it's inside, let's say if it's inside the vagina, for example, and it doesn't hurt, it's painless, how do you know it's there? You probably wouldn't, right? But either way, even if it's outside the body, it doesn't hurt. And guess what else? It goes away without treatment in about 2 to 6 weeks. So let's say we notice this lesion on our body and we're concerned about it and we're thinking maybe we should get this checked out. And then what do you know? It goes away by itself. Are you likely to go get checked out? Probably not, right? We think, okay, it's gone, I'm good, right? But that's the thing. Primary syphilis, that is the telltale sign that it's there, is there's going to be a painless lesion that goes away on its own. Secondary syphilis. So secondary syphilis is the main thing that happens here is a generalized rash. When I say generalized rash, I just mean it looks like a red dot rash, just like any old rash. Nothing specific. And that usually goes away within a few weeks without treatment again. But here's the way to be able to really tell, this is the main distinction for this rash. It usually appears on the palms of your hands, the bottoms of your feet, or on the trunk of your body, so just your torso, front or back. Those are the only the location is the only defining characteristic of where this could be. So that's the main thing with secondary syphilis stage, and you may experience some emotional feelings or fever, but for the most part the rash is the main thing that you're going to look for, and it goes away on its own. Now, just want to mention, between primary and secondary syphilis, if you're in either of those stages, it's completely treatable. You get treated, done. You don't have syphilis anymore, okay? Now, the last stage, the latent stage, this is when there are no visible symptoms anymore. However, you can have nervous system dysfunction, and this is permanent, okay? So if you get to latent syphilis, you're at risk for any of these things and more. Blindness, paralysis, crippling, brain damage, and possibly even death eventually. And we see about 20,000 cases when we saw of those 46,000 in 2008 were in this stage of syphilis. So if you get to the latent stage and you haven't treated it earlier, any damage that occurs here is not going to be able to be reversed. You can still get treated for syphilis, and the syphilis will be gone, but anything here is permanent. So that's why, these first 2 stages really give you some warning signs. Hey, get checked out, get this addressed. But if you don't, that's when latent syphilis can be really dangerous. Okay.
How long after exposure does the latent stage start?
It's
Is
different
this
for
years down the
everybody.
road, or?
Yeah, it could be, I guess mostly I see years, or it can be as short as months, but usually it's a year. It just depends on your body and how your body moves through these things. But you may experience latent syphilis as soon as 6 months or even less sometimes. But like I said, these other 2 stages are begging you to get checked out, right? They're saying, hello, I'm here, get checked out. And it's pretty easy if you just pay attention. Like I said, you're the expert on your body. If you notice something different, always get checked out. A rash sounds like, oh, it's just a rash, but it may actually be a manifestation of something different than just a rash.
It doesn't go away. And that's one of the things people, oh, well, you know, if I pray a lot, maybe it'll just disappear. Your cases of over 15 years of latent phase syphilis.
If you don't get treated, you'll have syphilis indefinitely. Even if, like I said, if you're in latent stage, you can still get treated for syphilis, so you should always just get checked, get treated, get it done. If you are in the doctor's office, you get your syphilis test. It's usually a blood test, and it comes up positive, but they don't know where you are in here. They'll just treat you as if you have latent, because it's a slightly different it's all antibiotic, but it's a slightly different treatment for the latent stage versus primary, secondary. But if they don't know where you are, they'll just automatically treat you for latent, and that way you're good to go. Now I have a link here that I wanted to show you. I think we have some time, but I came across this. A student in my class that I'm teaching a class this semester came across this from a health communication perspective, and I just had to share it with you. So this is a syphilis campaign that was done, I believe, in San Francisco, and they came up with this healthy penis motif with the 3 characters, and there's a whole little video that I can show you, but I don't know if we have time. If we have time at the end, I'll definitely show you. But basically, it was specifically targeted to the men who have sex with men population, MSM, who have the highest rates of syphilis. They also have very high rates of syphilis and HIV together. So the whole campaign was focused around making sure people knew about syphilis, getting treated, getting tested for HIV at the same time. So if we have time at the end, I'll definitely show you because it's pretty interesting. They were planning to start this in Philadelphia. I just don't know what the timeline is. And they were putting these things on like the subway billboards and commercials that were running, and so it was a pretty broad-based media campaign. So we'll talk about that a little bit later. Any questions on syphilis? So I just wanted to show you, as I just alluded to, this is syphilis secondary and primary cases reported by sexual orientation. And as you can see, the MSM population by far has much higher rates, which is, again, alarming to the public health community. What can we do to make sure people know about this and they can prevent this and they can get treated? And, you know, it can be as simple as using a condom to prevent this. So that is, and then again, the fact that it's so commonly associated with HIV infection as well, condoms are really the answer there. And you can see heterosexual men and women. So now we're going to move on to viral STDs, and this is the part where you probably will get mad at me. Because I'm going to tell you information that you just don't want to know, but it's the truth, and I'm going to tell you. Okay. First, we're going to talk about good old herpes. Okay, herpes genitalis. Herpes genitalis is the category of strains of this virus. Herpes simplex virus is the actual virus that causes genital and oral herpes. Okay, so you'll see HSV1, HSV2. They're different strains of that category of virus. Okay, HSV1 is usually oral, and as you can see, I made usually very clear because HSV1 can appear orally or genitally. HSV2 can appear orally or genitally. So they can appear either place, but we usually see HSV1 orally. What do I mean? Cold sores, fever blisters, whatever nicer name you want to call them other than herpes. That's what we're talking about, okay? So yes, they are all herpes, okay? And this is the part where I'm sorry, but this is the truth. And basically the nice thing, if you want to think of it as a nice thing about oral HSV1, is one, it usually only appears one sore at a time. So you get one at a time, it goes away, and that's that. You're only contagious, when you have a sore present and slightly right before the sore appears, when you can feel it coming. So HSV1, you're really only contagious when the sore is there. Same goes for HSV1 on the genitals. If you have HSV1 on the genitals, you are only contagious when the sores are present. All right, and you tend to get far less sores on the genitals if you have genital herpes, and it's HSV1 versus HSV2, which I'll talk about in a second. So any kind of contact with the sore, that will make you very contagious. And I mean, that's everything from kissing to sharing chapstick to sharing a water glass. Any time that you're having any contact with a person who has a sore. But the most important here is oral sex, okay? If somebody has oral herpes, they have a sore present on their mouth, and they give somebody else oral sex, that's how you can transmit it orally to genital, okay? So it's really, really important. People think, oh, oral sex is safe, right? You can still get STDs from oral sex. And if you don't remember anything else from this day, that's what I hope you will remember. Sex means 3 things: oral, vaginal, anal, okay? They're all potential for transmitting STDs. All right, so I should just take this statistic off. It's so goofy. 5 to 30%, that's a huge range. Genital herpes are caused by HSV-1. Sometimes that means we just don't know, but up to 30% we've seen could be HSV-1 on the genitals. All right? Okay, HSV-2. Usually, this is our genital herpes strain. It's a lot more unpleasant, okay? Approximately 45 million people have this. This is the prevalence at any time. 1 in 5 people have genital herpes. So, that means if we count it off by 5s in this room, doesn't mean that you have herpes, but I'm just trying to give you the volume of the situation. A lot of people have this, okay? We know that there are oral meds out there. I'm sure you've seen the commercials of the people running on the beach and they're so happy to have their herpes, whatever. The point is, they want to make sure that they market this medication because people are embarrassed to seek it out, but that's their attempt to make it less embarrassing. But it makes it a little bit more confusing usually. But anyway, the oral meds can decrease your outbreaks by 75%, which is significant. Excuse me. And basically, you have to take them every single day for the rest of your life. And they don't work if you don't take them every single day. So, I think I need a water break. Is there water outside?
No, this hasn't been open.
Thank you. Thank you. All right. It's my allergies rearing their ugly head. All right. Back to herpes. All right. So, one thing I do want to make sure that everybody's aware of is HSV-2 is contagious, even when the sores aren't present sometimes. So, sheesh. So, what that means is if somebody's skin looks totally normal, because I've heard people say that all the time, you know, oh, I didn't see anything down there, everything looked fine. Not always the best indicator that they don't have a disease per se. Even if there's nothing there, sometimes there's a certain stage of HSV-2 called the shedding stage, where literally the virus is just shedding from your body and you're very contagious and you have no symptoms. You have no idea when it's happening, it's just happening. So that's the main difference between HSV-1 and HSV-2 is without the presence of the sores, HSV-1 is not going to be contagious, but HSV-2 can be, even with nothing there. The other thing is that HSV-2, when you get an outbreak, it's a lot of sores. Very uncomfortable. When I'm talking about sores, I'm talking about blisters, pus-filled, extreme discomfort, okay? And with HSV-2, if you have that orally, let's say somebody had HSV-2 generally and you give them oral sex, you get it orally, you won't just have one sore at a time. You'll have a massive outbreak of sores on your face, okay? So big difference there. Same thing with the genitals, many more sores than if you have HSV-1 genitally, okay? So it wouldn't be just one at a time, big difference there. Any comments so far about HSV? And it can be passed through the placenta. And if it's passed through the placenta during pregnancy, it can be fatal to the fetus, which is pretty serious. So I just want to mention that as well. Yeah.
So let's say you contract HSV-2, you can't have a baby then.
You can, but you have to know you have it so they can help to block it, just like with HIV.
Okay.
There are drugs out there that they can use as a prophylaxis to block the passage through the placenta, through the umbilical cord. But if you don't know you have it, that's where you can get stuck. Any other comments here?
Is it true? I heard that that if you get tested for herpes and it says that you have HSV, they can't tell which one you have. They just know that you do have herpes.
Yeah, it sometimes is really difficult to tell which one you have. And one thing I want to mention for testing purposes, most places can't test you unless you have a sore present to biopsy. So they need to be able to withdraw fluid from a sore to analyze that. There isn't really like a blood test because there are a lot of herpes viruses out there. For example, chickenpox, varicella zoster, that's in the same family of viruses in herpes genitalis. So if you got tested for like a blood test and they were able to discern that you have herpes genitalis or a herpes virus, probably isn't going to help you. It may just mean that you still have, because when you have a virus, you have it forever. It lives in your spine. So the only way to test these is if you have an actual sore, usually. They do a biopsy. But yeah, you're absolutely right. They may not be able to tell you. You'll probably know between the two, though, just based on how many sores you have and how frequent your outbreaks are and that sort of thing. Any other questions? Yeah.
So if you have herpes, that's been like really rise for health insurance, wouldn't it?
I don't know, and I don't know because you're on a medication for the rest of your life, which is relevant to insurance. I try to stay away from insurance as much as possible, especially these days with all the craziness going on. But part of the healthcare reform is to not discriminate on pre-existing conditions. Herpes is just the tip of the iceberg in that department. That's pretty minimal compared to other pre-existing conditions, but I don't know how insurance reacts to it. I don't know what the copay is or anything like that. But
It's a good point. We don't know, when you have high blood pressure, it's going to affect your health insurance. When you have diabetes, it will. I know they ask for sexually transmitted infections and insurance policies, but I think they have more important things to worry about. But after hearing all this, I'm sure that this is the best abstinence education you've ever received.
hey, you're lucky this isn't a Friday class, because I've done that to my class before. Not the best thing to hear on a Friday afternoon, but yeah, basically, even if you talk about HIV and the medications associated with that, definitely a totally other league. But it's a good point. I don't know how insurance deals with, or ideally they're not discriminating against anybody, but we're not going to go there. But it could be an issue. I don't know what the copay would be or anything. All right, so we have a little bit more on, I already said this, but I really like to make sure it's extra, extra clear. They can both appear genitally or orally, and they can both be passed, vice versa, either way. And I used to go through all the different stages of herpes genitalis, or HSV, but just for the sake of time, I'm going to keep moving because HPV, which is something we're hearing a lot about these days, is the human papillomavirus. And I'm going to just talk a little bit about what it is, and it's linked to cervical cancer. I have a little video clip to show you, so we'll get through this, and then...
7 minutes.
Yeah, so we have 7 minutes? Holy moly. All right, we got to make some tracks. Okay. So this is the most common STD in the United States. Probably the most forgotten about a lot of the time until recently. And you'll see down here, HPV is not a reportable disease, which means that when somebody is tested for HPV and they have it, that clinic is not responsible for reporting the diseases, like I mentioned with chlamydia and gonorrhea. Okay? So definitely a different ballgame. What that also means is we probably have a lot more cases than we realize, and we already have a lot of cases that we know of, so it's kind of a scary situation. It's contracted through skin-to-skin contact with an infected person. I don't think I mentioned this with herpes as well. Herpes, the sore is the most contagious, but it is skin-to-skin contact that transmits herpes and HPV. All right, so it's tricky because even using a condom sometimes doesn't fully protect you. There are more than 100 strains out there, and about 30 strains are sexually transmitted, so they're passed between sexual relations. And HPV in men versus women, so for men, it really doesn't pose any known health risks if you have HPV, however. So you could live a normal life if you have it, and you may not even know you have it. you can still pass it on to other people. So from a transmission standpoint, you're still a carrier of that disease, even if it doesn't affect you personally. Women, we're going to talk about cervical cancer. HPV in women is much more serious because there are about 13 strains of these 30 sexually transmitted strains that have been in some way linked to cervical cancer. Okay. So testing options for men, we really don't have any. And again, they could do a blood test, but there are a lot of human papillomaviruses out there, so we can't always discern if it's one that could potentially be hazardous to a female, for example. We just know that you may have it or not have it. And then for women, the most common testing is through a pap smear. And what they'll do is they'll swab the cervix and take a sample of cervical cells that will be analyzed in a lab. And what they're looking for in a pap smear is just any abnormality of the cervical cells. A pap smear is not going to say you have HPV, you do not have HPV. It's going to say normal, abnormal cells. Okay? If you have an abnormal pap smear, then you would be referred for a colposcopy, which is a more invasive test of the cells on your cervix. Sometimes they'll biopsy your cervix, and they'll be able to discern what the abnormality is. Is it HPV? Is it something else? And they'll be able to take it from there. But you have to get the colposcopy to know that you actually have HPV versus the pap, which is just normal or abnormal. Genital warts are the only physical symptom of HPV. Most of the time you have HPV, you have no idea, no symptom. If you have a strain that causes genital warts, that's the only visual symptom for men or women that you'll ever get. And they can be flat, they can be raised, they could be pink, gray, yellow, you name it. They can be individual, they could be in clusters, they could be, they manifest in a lot of different ways, internal or external. So again, rarely any signs or symptoms other than the warts. Okay, so I got ahead of myself. But one thing I want to make really, really clear here, and you can see where they can appear on men and women, the treatment. So this is treatment for the warts. This is not treatment for HPV. There's no treatment for HPV. Just like herpes, HPV, they're your friends for life. You've got them forever, okay? You can't get rid of them. But you can get rid of the warts. You can get them frozen off or taken off with acid. But they can come back, but sometimes they don't. So you may be able to get rid of them that way, but the virus is still in your system, in your spine. You can still pass the virus on to other people, so you always have HPV. Okay, so just to give you kind of, oh geez, I don't know why that's not showing up. This just shows you, it's a pie chart, and more than half of the pie chart shows HPV versus all of the other STDs out there, because the incidence is 5.5 million people. So that's a lot of people. And the prevalence is 20 million people. So again, incidence, 5.5 million new people in a year. Prevalence, 20 million people at any given time have HPV. And those are only the ones we know of. Like I said, there are plenty of people who have it, we don't know they have it. All right, so of the 30 types of HPV that are sexually contracted, they're all identified as high risk or low risk. So there are about 13 strains that are high risk, and they're high risk because they're related to cervical cancer. But just these two strains, 16 and 11, are responsible for 70% of cervical cancer cases in women. So just those two strains of HPV lead to 70% of cases. And there are 493,000 new cases of cervical cancer worldwide in a year. Just to show you, 274,000 deaths occur due to cervical cancer in a year, but 80% of those deaths are in developing countries. In this country, it's about 4,100 deaths every year from cervical cancer. And just to give you a context for breast cancer, over 40,000 deaths from breast cancer in a year. So the thing that I want to take this, I want you to think about here is that we have really great screening for cervical cancer through our pap smears and through our pelvic exams, which is why our death rate is so low. We're able to catch things quickly. In other developing countries, they don't have that. Really quickly with Gardasil, and these didn't come up either, but basically Gardasil is the new-ish vaccine. It came out in 2006. For women still, it's only targeted to women, ages, I believe it's 9 to 26. This is supposed to protect you from the 4 most hazardous strains of HPV, which are 16 and 18, like I mentioned before, which account for 70% of cervical cancer, and then 6 and 11, which account for 90% of genital warts. So it covers 4 strains, and it's 3 injections, just like if you ever had hepatitis B injections, which you probably have by now. 3 injections, it's 1 injection, and then a second 2 months later, and then a third 6 months from the first. It does protect you even if you don't get all 3, but it's only fully protected if you get all 3. So, we made it. These are just some resources that I think are great. The CDC has a great website for STDs. Anything you can think of is on there. And then this is a great website for testing locations and where to get tested in Philadelphia. I have a couple of videos that I'll just pass along to Dr. Siegel so you can see them at another time. Any last questions, though? How are we on time? Are we totally good?
We have time for 1 question and 1 applause.
Any questions? 1 question?
Yes. You're first getting married, and I'm presuming you don't have any children yet, right?
Correct.
Would you recommend that your child at 9, 10, or 11, even up to 12, receive this Gardasil?
Well, by the time my child would be that age, I would go do more research on it. But probably, because I think they need to be vaccinated younger since it's before they start having sex, ideally, not when they're already having sex and it's too late, right? So, but some people, that's made them really uncomfortable. But I would have my child vaccinated most likely. I'm also marrying a doctor who's very pro-vaccination. I guess that may or may not be my decision to make. So, but yeah, I would do it.